How to produce more breast milk. Most moms produce 1/3 more breast milk than their babies will drink, so there may be a little leeway for you. However, if you're hoping there's a quick fix or a fast way to increase your breast milk supply, especially in one day, there isn't. Still, if your breast milk supply isn't where you'd like it to be, here are some ways to increase your breast milk supply. Practice skin-to-skin contact. Cuddling your undressed baby on your bare breasts can help stimulate the release of breast milk before you have a breastfeeding session. Breastfeed as soon as you can. If you can, try not to wait too long after the birth and delivery of your baby to begin breastfeeding. Starting within 1 hour or so can help stimulate your breast milk production. However, in some cases, such as if you're recovering from a cesarean section, you may end up starting to breastfeed a little later. Use a breast pump regularly. Pumping may help stimulate the production of more breast milk, increasing your supply. You can maximize your time by pumping both breasts simultaneously with a double breast pump. Pumping can also come in handy if you need to return to work. Breastfeed often. The more you nurse your baby, the more milk you'll tend to produce. Breast stimulation and frequent removal of milk are what help boost milk production the most. If your baby finishes feeding before your breast is empty, try hand expressing or pumping, and store the extra breast milk. Make sure your baby's latching on properly. It's important for your baby to latch on correctly and to swallow while feeding. If your baby is latched properly, you'll notice they have flared lips, their chin will touch your breast, and their ears might wiggle slightly while nursing. If you're unsure about this, your healthcare provider or a lactation consultant will be able to help you confirm that your baby has latched on and is swallowing properly. Try compressing your breast during a feeding. If you notice your baby is sucking at your nipple but not swallowing, you can help your breast milk flow by gently squeezing your breast. Simply place your fingers under your breast with your thumb on top above the areola. Press until you see your baby swallow, and then release. Nurse from both breasts. Remember to alternate between breasts. As soon as your baby slows down or stops feeding from one breast, offer the other. You'll need to drain both breasts to produce more milk. Don't forget, you can also use a pump or hand express any extra milk from the other breast if needed. Don't skip feeding times. Try to keep to a regular feeding schedule, nursing about every 2 to 3 hours in the first few weeks. If you're working while breastfeeding and you're pumping breast milk, try not to miss any sessions, as this can affect your milk supply. At work, aim to pump for 15 minutes every few hours. Wait before introducing formula or solids. Unless recommended by your healthcare provider, you may wish to avoid giving your baby formula or cereal until they reach 6 months. Your baby may lose interest in breastfeeding if you introduce formula and solids too early. This can cause your breast milk supply to decrease. Wait before introducing a pacifier. It's a good idea to wait 3 to 4 weeks after your baby's birth before giving them a pacifier, so that your milk supply is well established. Talk to your healthcare provider about any health issues or medications you're using. Hormonal issues can affect your breast milk supply. Your provider will be able to diagnose any issues. Although some medications can decrease milk production, your provider may be able to offer an alternative that is suitable to take while breastfeeding.